Yes. Good morning, everyone. I was not really prepared for where this meeting was going to go until I heard everybody's arguments this morning, and I just have a few comments. I worked in science. I believe in science. I actually played with these types of viruses, not COVID, but my entire career in activating viruses. So I'm very familiar with how they're transmitted, the severity of them, and how in March it was necessary for us to vote for a public health emergency and to empower the governor to make those decisions on a quick basis. I think it's very important now, though, that we've seen the numbers decline, and this is because all of our citizens in the state of Connecticut have been with us on this journey, that we remember that once a pandemic is declared by WHO, which is the World Organization of Health, it can last for 3 to 4 years, the definition of a pandemic. And I don't believe that when we empowered the governor under the public health emergency for 6 months, that our average everyday citizen that is out trying to work, trying to feed your family, trying to get your children back to school, was thinking that this was going to continue on a rolling basis for 6 months, for a year. If the pandemic does last for 3 or 4 years, is this going to continue through whoever is the next governor? I think we need to have checks and balances. And we've heard today that the governor is willing to work with our committees. I have to be quite frank with you. There have been committee meetings that ranking members on public health who have science backgrounds and who are medical doctors have not been included in. There are people making decisions at times that don't have a science background. And I think that that is what needs to change. We need to change the communication that we're having with the governor's office. I think that initially it was good. It has petered off dramatically. And I think that we do need to look at the science and we need to get the data. And that has been something that hasn't been available to us. And I will give you an example of something that I found out just recently that's very troubling to me, that could have been changed if we had a better dialogue of communication. We know what has happened with the nursing homes here in the state of Connecticut, and it has been tragic. Again, we were learning about the virus in real time, so to speak, as the virus, the information on the virus was becoming more apparent to the medical community. So during the time that we had some significant deaths in nursing homes, we sent in DPH inspectors along with National Guard. Not one of them had a COVID test before they went into the nursing homes. So here we are, not allowing family members to see their loved ones as they're dying with the proper equipment and protection in our nursing homes. But we are, as a state, sending in DPH inspectors and the National Guard that have not had a COVID test. If we had had better communications between members of our committee and the governor's office being willing to reach out and meet, maybe even with this committee on a weekly basis, on an hourly basis at certain times. I mean, we all have Zoom meetings all day long, every day. There's no reason this committee of 10 could not have met. But that has not happened. And that is what we're hearing from our constituents. I have received hundreds of emails, and I'm sure everyone else on this 10-member committee has also, not just from my district, but from around Connecticut, saying, please end the public health emergency authority of the governor. We need to be able to weigh in. We need to be able to have our voices heard. And that's what the legislature is supposed to do. We are representing our districts and the state of Connecticut, and there is no reason that we should not, if this public health emergency powers are ended, that we cannot continue the communication with the governor and make the decisions to continue to keep our citizens safe here in the state of Connecticut. No one here on this committee, or I have heard of, which you've heard coming from other people today, is saying throw everything out. No one is saying that. What we're saying is we need to have better communication with the executive branch, who is making and has total authority to make any decision they want. That's over budgets. That's over my fishermen that have to have an inspector on their boats that has not had a COVID test, and what's happening in our parks. So I think it's really important, because right now Connecticut is being ruled by one person. And that is the governor, and that is the governor's executive branch, and that is the governor's office. We can have input, but we're not sure that input is being heard in many, many cases. And I think that that's an important difference for here today. And I'm not an attorney, so this whole thing about civil preparedness versus the Public Health Emergency Committee, if the public health emergency is covered under civil preparedness, I'm not really sure why we're even voting today. That doesn't make sense to me. I'm willing to go back in and change the statute. One of my arguments also is if we extend this power for another 6 months, as has been pointed out earlier, we are actually tying the hands of the next legislature, whoever is elected, to come in before they've even sat in their seats. And I think that's something that needs to be changed. So as much as we've heard today about, you know, if we don't pass this order, that we are throwing out everything we've done, that we're risking the lives of people in our state, I don't believe that to be true. I want to commend the governor. I think he's done a good job to date, but I think now we have to look at it more even on a regional basis. What's good for Danbury might not be good what's for southeastern Connecticut. And I think that the broad stroke that you have in an executive order is something that really needs to be looked at. And the only way that you do that is to have the input from the legislature. And it could be this committee, it could be the committee of the Public Health Committee, but to be able to work together in concert, you know, we have to have checks and balances here in the state of Connecticut. And we don't have that currently under the way the system is working. I know has said that he will be better at having the meetings, but when this first started, we had a subcommittee made up of outsiders who was going to decide a reopening committee on what was going to happen with the state of Connecticut. That didn't include legislators. So we had really an outsourced group telling us how we were going to reopen. We set up guidelines for phase 1, 2, and 3. We have clearly met the guidelines for phase 3, and yet nothing has happened on phase 3. So that's why I think it's really important for the people that are listening to this. This is not about trying to strip away everything that the governor has done. There is no one who believes more in masks and hand washing than me. These are the #1 things you can do to mitigate the virus, is keeping your hands clean and wearing a mask. And I think that everyone on this committee can agree with that. But I do believe that it's time to get back to the legislature being able to be at work and to be available and have the voices of the citizens heard here in the state of Connecticut. We can come back to vote on a police accountability bill. We can come back to put these executive orders that we feel are appropriate in statute if we have to. Thank you very much.
Thank you, Senator Summers.